Welcome to the Private Practice Startup, where we inspire you from startup to mastery. We chat with entrepreneurs, experts in the mental health and business arenas, and successful private practitioners to give you the tools needed to make your dream practice a reality. Visit theprivatepracticestartup.com for awesome resources, free trainings, and so much more. Here are your hosts, Dr. Kate Campbell and Katie Lemieux.
What is up, Startup Nation? Welcome back for another episode of the Private Practice Startup. We are excited to have you. We wanted to say thank you to our loyal listeners who tune in every week. And if you are brand new hanging out with us, that is awesome. We want to make sure that we give you a thank you gift. For our first-time listeners, we have a special gift for you, and we want you to head over to our website, privatepracticestartup.com. Head over to the resources tab, and there you'll find our A to Z cheat sheet, everything that you need to build and grow your dream practice. And excuse me, I must have some bad manners. I totally forgot to introduce my business partner. Whoa, bad manners.
You didn't introduce yourself either. Just the show.
Wow, okay. Yeah. It must be all those tech issues we had for the last 30 minutes. So everybody, I am Katie Lemieux, and I'm here with my amazing business partner.
Hey everybody, Dr. Kate Campbell.
All right, I got the manners back on. That's awesome. And furthermore, we'd really love for you to hang out with us in our favorite place to hang out in our Facebook group. And of course, just head over to Facebook and look for the Private Practice Startup, and they're just asked to be part of our group. So last week, we had an amazing podcast. One of the things that I really love talking about the most is money and taxes. Why do I love talking about taxes? Because when you hire the right accountant, you can actually save a lot of money on taxes. So we had our friend, my friend and colleague, Suzanne DeCobo. She's a CPA, and she talked about tax strategies for private practitioners. So make sure you listen to that. And if you hadn't, you want to make sure you go head back and listen to that. But today we have a super special guest. Her name is Laurie Eckelberry. She is actually here with us in the South Florida area. So we are excited to have her. She is going to be talking about what to consider when starting a successful private pay intensive outpatient program. So this is really exciting. Welcome, Laurie.
Thank you. Hi. Thank you.
We're excited to have you here. Dr. Laurie and I met, I'd say probably about 6-7 years ago, something like that. We were renting office space in the same office building, and we've collaborated and developed a colleague, friendship, relationship. Right. And so I'm excited to have you on the podcast here today.
Thank you. Thank you for having me.
And this is a really niche-based area, and I'm really excited to hear kind of your story and your tips and things like that, and really helpful for people who might be thinking of this. I think this is awesome.
Yeah, it's so interesting. I know Startup Nation will be really curious to hear about your experience in building a private pay IOP, because a lot of people have IOPs, but most of them are insurance-based and yours is not. So tell us a little bit about your experience with that.
We built it out of necessity because I've been in private practice for 11 years in a group private practice. And we worked with a lot of chronic patients working in eating disorders and substance abuse and personality disorders. And so very often we had to refer people to a higher level of care. And we were quite disappointed with a lot of the programs that existed. Often insurance didn't cover it, or there were a lot of limitations. And if people weren't severe enough, they were turned away from a lot of programs. Right? So if it wasn't an absolute emergency in the moment. And so we found that a lot of people kind of got stuck in the middle. And so we really created the program out of necessity.
Interesting. And you're right. And I think one of the things that, down here in South Florida and Delray, I think is like kind of the capital of the substance abuse. A lot of people think California, but that's not the case. And I know that there's a lot of frustration, especially with, I actually used to be a clinical director of a substance abuse facility, and with insurance, they're putting people from a PHP to IOP within less than 30 days or even 3 weeks. And then they're an IOP and they're really not ready to go out. And so I really love the fact, and I'm curious to hear more about it. I'm sure you guys are able to provide much more of a quality care and a continuum of care for the IOP and really, really serving the patients. So I think that's really amazing.
Right. Yeah, we found that insurance ended up being an obstacle for people getting the actual treatment that they really needed that was going to help them long term. Unfortunately, it's expensive for people to come out of pocket to do IOP. Essentially, we find that the treatment is shorter because it's individualized. You're not bound by the confines of insurance companies and what they will and will not let you do. We're able to treat people and give them what they need, which just seems to be more effective. And so, essentially, it's money better spent in the long run anyway.
I know you're sharing a little bit about your experience in building the IOP and how it's based on need. And through your private practice experience and your journey, you realized that that was really what your clients were needing most. And I'm curious, what led you into private practice in general?
Well, I always knew I wanted to be a psychologist and just have a love of business and wanted to create something of my own. I started planning my private practice before I had my doctorate completed, before I was even in practice myself. So 2 years during the internship and postdoc process, I was planning out my business model and exactly what I wanted to do, even then.
Nice. So that was always your dream. You knew you wanted to be an entrepreneur, create your own business, and you really took the time to develop that. And it shows because you have a very successful group private practice and IOP as well. Share with our audience something that you've had to overcome to be where you are today with your business.
I think that it's great that you guys do this because the biggest obstacle that I had to overcome was the lack of business knowledge. The majority of clinicians go into private practice and they're really not taught anything about business in graduate school at all. I kind of fumbled through my first couple of years. Really just making a lot of mistakes and evolving through that. So creating the IOP after being in practice for 11 years, I think was a little bit easier because I didn't start from scratch. I had already learned quite a bit. But that was an obstacle. Fumbling for a few years after graduate school was quite a challenge and at times very discouraging. We're working on an article right now talking about how students really need to be taught more about the business of psychology in general.
Yeah, and we can totally relate. We made a ton of mistakes, and obviously we learned from that and have put that into really our passion in the private practice startup. And it's interesting, and even coming into an online business, I think then we had another growing curve. Even though we've been in business, we made a ton of mistakes in the online business as well. And now we're really getting our groove and really kind of advancing and progressing more. But it's definitely a different animal. And it's been fun, but it's definitely a different animal.
It's a journey for sure. Yeah, there is a huge gap in graduate school, and it's unfortunate because there should be a track for people who want to be in private practice. I always knew I wanted to be in private practice as well. And as soon as I graduated with my master's, while I was still in school getting my doctorate, I was in private practice on the side and really trying to learn how to build and grow a business. And it took me several years as well in the beginning because I had to learn everything the hard way. But then once you learn what works and you learn how to implement all of that, you really can grow your business quite successfully, which is great.
And so before we jump into our topic, we just wanted to thank our sponsor, which is Brighter Vision. If you guys are looking for a website, if you already have a website and you're looking to update it, our friends and colleagues over at Brighter Vision are really, really amazing. They have a clear system on helping you create your therapist website, and they solely work with therapists. So you're going to get treated very well. We encourage you to check out Brighter Vision. And actually, if you head over to our resources tab, you will find we have a link there for Brighter Vision. And you actually get, I think it's a free month, right?
Yes,
you sign up,
first month free.
The first month free, sign up through our link. We'll go ahead and post that in the show notes. But go ahead and check them out. Check out the beauty of the websites that they produce of your colleagues. So we want to say thanks for Brighter Vision.
So let's go ahead and dive right into your topic. I know you've got several tips for us today on what to consider when starting a successful private pay IOP. What is tip number one?
Really planning. I think knowing what it is that you want to do and having a very detailed plan about how to achieve it, not just starting an IOP, but, what kind of patients do you want to see? What kind of services do you want to offer? Will people be employees or will they be contractors? What will be the model of treatment or the different things that you offer? Who will be included in the program? Who won't be? What kind of exclusions will you have for the program? And really just a lot of details. We had a number of meetings with graduate students and all of our staff at the private practice before we ever launched the IOP, just to kind of fine tune what is it that we're going to do? What kind of problems do we anticipate? How are we going to overcome these things? And, how are we going to build something that is of such worth that people will be willing to come out of pocket for it, that it's going to be worth it for them to do that? Most people have insurance. So to choose not to use your insurance, there has to be a real reason to do that for people, I think.
I'm sure that's a big question that Startup Nation is wondering right now. How have you been able to market to people wanting to pay for your IOP as opposed to using insurance?
I think the biggest component is the fact that it's individualized. It's not a program that exists cookie cutter and then people come into it. So essentially you're making the patients responsible for fitting into a program that way. where we're very individualized. So when a person comes in for an assessment, it's a very detailed, comprehensive assessment. And then we build a treatment plan, which we call a blueprint. We build a treatment plan that is specific. So if you have the ability to offer a patient anything, any types of therapy, any types of groups, what would you do for this patient? And we build a therapy specifically for them. And then that's what a patient gets for the money that they pay out of pocket. They're getting a treatment program designed specifically for them.
And do you find that your clients are coming and have already had many kind of bouts with substance abuse facilities, or are they knowing that they're looking for something different right off the bat, or a mixture of both?
I mean, we treat substance abuse, but we're not a substance abuse facility.
Gotcha.
So
I know you said eating disorders as well.
Eating disorders and also primary mental health.
Okay.
So, just people who are more chronic, they're not necessarily appropriate for a traditional outpatient. They need something more. They need to be in groups. They need therapy a few times a week. They're really struggling. And so what we find is sometimes people have been in outpatient therapy, just weekly outpatient therapy for years, and they haven't really seen a lot of progress. Maybe their outpatient has kept them from getting worse, but they haven't really been good candidates from the get-go. And so they haven't really been progressing maybe as well as they could have.
Gotcha. And what type of marketing or advertising do you do?
We get a lot from our private practice because now the place that we refer, and we give people other, options also, but we're one of the referrals that we provide to patients that need a higher level of care in the outpatient private practice. And we get a lot from practitioners, right? So we have a lot of friends, networks, of other psychologists being in practice for 11 years. And so often I think clinicians feel frustrated with where a patient's not progressing and they want something more for them and they're looking for a place to send them, and we'll take them and then send them back. So for substance abuse, it's easier, and for eating disorders, it's easier to know when to make those referrals, right? Because people are really struggling and think, well, this is a specialty area. This person probably needs to go, to an IOP or to inpatient for these kind of issues. But sometimes when someone's depression, they're not necessarily suicidal. So you don't need to Baker Act, but their issues are so chronic that they're really not progressing. And so we find that we've been a good resource for clinicians who are looking for a higher level of care, but not necessarily an inpatient facility.
Yeah, I'm excited just hearing you talk because I'm like, oh my gosh, what a great resource. So yeah. This is really good.
And I know you mentioned that you guys tried to have the foresight and look ahead and plan for what kind of challenges might we run into and how can we overcome those challenges or anticipate them. So what have been the biggest challenges with the IOP?
The biggest challenges, I think, have been getting a good group of practitioners to where the integration works well. There are a lot of moving parts for it to be successful for the patient. We can't just make a referral and have a person see the dietitian or to see the psychiatrist and then not have that care integrated. So that was one of the problems that we saw with programs previously that exist, that the left hand doesn't know what the right hand's doing. And so, people aren't really coordinating the care. That's a big challenge, is getting all of the practitioners together to work together with patient care and to be on the same page and to consult over and over and over. I mean, we consult regarding each patient a number of times a week. That's probably the biggest cost for us, is not the actual treatment that's taking place, right? The face-to-face contact. It's the consultation. It's the behind the scenes, coordinating what's happening, revising a treatment plan, making sure that it's working, constant progress measures, analysis of the progress measures. What does this person need? What's working? What's not working? And revising. So, I think just as many hours. Now that we're doing super bills for people, we can see the hours. It's about 2/3 face-to-face and 1/3 is behind the scenes, actually. And so that's been a challenge. It's been a fun challenge, though, but it's been a challenge.
As you talk, I'm hearing your very analytical mind, the data, the tracking, and that's all so exciting because when I did business coaching, my business coach would say, you cannot change that which you don't track, right? So if you're not really looking at the data, you don't know where the holes are or where we can make improvements. And so I love that there's such an eye for detail behind the scenes to really provide such a great quality of care. So that's really cool.
Yeah, thank you. Thank you.
So tip number 1 was preparation and organization. What's tip number 2?
Tip number 2 was, kind of along the lines of finding your niche and a need. I think that what made us all so passionate about this was that we were creating something that we knew the community needed. And so I think it's important. I just read an article the other day about how important it is for people to find their niche, and that they should be finding their niche in graduate school and really trying to focus and just general practice. A lot of people do general practice, but to really have a specialty area and to really know your stuff in that area, I think is where people get not only the most referrals, but patients are willing to spend money if they know that what they're going to get is going to be quality and that the person is really well versed in what they need. So I think that that's a huge component. Yeah.
It's huge and something we talk about and teach all the time. I just had a coaching call with someone who wants to go from insurance, and he's been in practice for about 20 years now and more private pay. We had the conversation about, niching and how important it is. And I always say, the brain surgeon or the neurosurgeon gets paid a lot more than the general practitioner. Why? Because they specialize. And the other thing too I talk about is I ask, what does Frito-Lay make? Well, they make chips, right? So if they started making like lawnmowers or bedspreads, that would be a little bit odd. And you probably wouldn't want to buy from them anymore. So because they make chips, that's all they do, and they are focused on chips, they probably do that really well. So when we focus and we niche, we continue to invest in our specialty, really like in what you said, Laurie, is creating a higher quality of care that people are willing to pay for. So thank you for saying what we are constantly preaching. We appreciate that. And it's always good for Startup Nation to hear it from someone else and not just us being crazy nuts about it.
It's very true. Let's move on to tip number 3.
So I don't remember what I gave you for tip number 3.
I'll surprise you. Commitment.
Okay. A startup of any kind is a lot of work. It's a lot of work. It's a lot
is
of
that
work,
true?
So a lot of dedication and a lot of sacrifice, financial sacrifice, a time commitment to be really devoted to it. It can be discouraging, especially when you have a vision and maybe some of the people that you're hiring, they're not as passionate about what you're doing because it's your baby, not necessarily theirs. And so I think instilling the commitment and the passion also in your staff is incredibly important. So one of the things that I have learned over time is that it pays to invest in your staff because turnover is expensive. And also, if we want to give people quality care, and we do, that's what we're selling, quality care, we have to make sure that our clinicians are also in good standing with their own mental health issues, that they're practicing what they preach. And so we've integrated a lot of that. We have an annual retreat where we do all day and team building. We do team consultation where we support each other in a 2 to 3 hour meeting every Friday. We turn off all of the phones and no patients are scheduled at all every Tuesday at 2:00. And our yoga person comes in just for our staff to do yoga and meditation with our staff. And just paying people maybe a little bit more, coming out of pocket a little bit more than maybe you can afford to in the beginning, because it pays to keep people. It's a huge issue in our field. And I think that we're not paid what we're worth. For people to really feel good continuously about the hard work that they're putting in, and we're working with chronic patients too, which can be draining. To keep the morale at work, I think, the commitment has to be all around and people need to be a team. So we've really kind of prided ourselves on creating a little family over here too.
And as I hear you speak, I almost want to get emotional. You're a woman after my own heart. I actually been in management and leadership since I was 26 years old and really grew to be a leader, trust my staff, and give more to my staff. Because when we give to our employees, whether they're independent contractors or not, they're going to do the best work that they can. And it's so important, especially in the mental health field. You're right. We see this inconsistency where we want our staff to provide such quality care. But yet, if they need to take a personal day or they need a mental health day, it's kind of like, well, do you have sick time? Maybe you need to use your vacation, or I don't think so. You need to get your numbers up. And it's just so disheartening. And to hear you talk about that commitment to your staff, that's just amazing. At the Private Practice Startup, we actually do a lot of team building and a lot of fun things with our team, doing different things and activities. And, we're always wanting to invest in them, assuring that they are acknowledged, supported, taking time to talk about their own practices. So that's just so great for you to hear. And Kate and I are really big on culture. And we just did a podcast with our friend and colleague, Melvin, on Selling the Couch, talking all about culture and the importance of that in business. And so I appreciate you, again, resounding that for us as well. And obviously, we really know what you're up to, just what you talked about with how you care for your staff. And then that equals great quality care for the patients. Thank you for sharing that.
Yeah, it's really awesome. And I know Laurie's invited me to do the yoga with them on a Tuesday, and I'm typically seeing clients then, but I definitely want to take you up on that opportunity because you're right down the street from me. It's really cool.
Yeah, great. You should.
Yeah. So what do you want our listeners to take away from your message today?
Just to be willing to sacrifice, but don't be discouraged in the process, because even though it's a lot of hard work, nothing is more rewarding. Like when it works and it finally all comes together, like absolutely nothing is more, well, maybe being a mom, but nothing else is more rewarding than that. It's both the private practice and the IOP. I mean, they've both been just a wonderful journey.
And having a business is like having a baby. It grows and evolves over time. And so you got 3 babies, right? You have your daughter and you have the private practice and the IOP. So
that's right. And it's a lot of work in the beginning, right? Exactly.
Yes.
We hadn't even shared that your company name is Institute for Life Renovation.
That's correct. Yeah.
Cool. So I just want to encourage anyone. I know we have a strong following here in the state of Florida. And so if you're already listening to this podcast, I just want you to listen to it from 2 perspectives. 1, the great stuff that Laurie is sharing, and 2, the possibility of this being a resource for not only your clients, but also for you. And I love how Laurie talks about, once they're done with a higher level of care, they're going to send them back to you. There's so much abundance in what we do. And if your client really needs support and a higher level of care, we definitely encourage you to check out Institute for Life Renovation and what Laurie has created. It's just been such a pleasure to have you on our podcast today. And I just want to acknowledge you for everything that you've created for your staff, for your company, and really for the people that we're committed to serving.
Thank you.
Thank you so much.
So I had a couple of other things just quick.
Yeah,
I
sure.
know that you had asked maybe for a book recommendation, and Stephen Wallfish has a great book. It's called Earning a Living Outside of Managed Mental Health Care, 50 Ways to Expand. It's a phenomenal, I think, resource for folks if they want that. And then also that we do a free networking and continuing education free breakfast once a month from 9 to 10, because we love to meet providers in the community and, learn ways that we can support each other. And then, just kind of like learn, something new and get a free CEU and breakfast. So
do you have that consistently, like once a month, like every first Monday or something?
It's not as consistent. It's every month, but It's not always like the second or the third because of holidays and things like that. We have to move it around. Our next one is December 15th. They are always on a Friday from 9 to 10. And then if folks are interested in that, they can always subscribe through our website. And then they will get the notifications of all the stuff that we, offer in the groups and that sort of thing.
And the website is renovationoflife.com?
Yeah, renovationoflife.com.
Okay, and we'll put that on our show notes too. So any local South Florida folks, if you are interested in meeting Laurie and her team, having breakfast, connecting, and getting a free CEU, that's a great opportunity. And I know I have supervision every other Friday, but I would love to come down and actually meet you and spend some time chatting with you.
Yeah,
so hopefully one of those Fridays, I won't be having supervision and I can actually come down, or maybe Kate and I can go together. Cool. So again, we just wanted to review. So number 1 is preparation and organization. Number 2 is need and specialization. And 3 is commit. Commitment is really essential to making whatever you're working on grow. And if you have a strong passion and vision, really commit to that, because really the world needs what you are up to. I know sometimes we think about and get worried about our own fears going into private practice or business, but if we actually don't take the step and launch ourselves, the world's missing out on what we have to give. So commitment. Startup Nation, we want to thank you for hanging out with us today on another awesome podcast, hanging out with Laurie, and of course, my business partner, amazing colleague and friend, Kate Campbell. So we want to make sure that you check out the show notes from today's podcast. And next week, we are going to have CPA, so another CPA, Craig Cody, talking about tax strategies to help private practitioners lower their tax bill.
Yeah, and who doesn't want to lower that, right?
That? Right. Saving money and making money. It sounds amazing to me. So you definitely want to check that out. And we would love if you subscribe, rate, and review. If you really love today's show, let us know how you liked it on iTunes. Go ahead and write a review there. So we hope you have an awesome and inspired day, and we look forward to continuing to inspire you from startup to mastery.
See you next time. Thanks for joining us on The Private Practice Startup. Visit theprivatepracticestartup.com for awesome resources, free trainings, attorney-approved private practice paperwork, and so much more.